Welcome to the Voices for Change virtual tour. This series was created to connect viewers with experts and survivors of gender-based violence so that we may learn from their experiences. This webinar on the shadow pandemic is coming to you from New Orleans, Louisiana, and presented with our partners, the New Orleans Family Justice Center and the University Medical Center of New Orleans. With support from our sponsor, United Way of Southeast Louisiana, Women United. I'm Tracy Schott, a social worker and filmmaker and founder of Voices for Change, created to increase awareness and understanding of issues related to gender-based violence. Today's panelists include Dr. Ray Taylor, Associate Professor and Chair of the Criminology Department at Loyola University, Mary Claire Landry, Founder and Executive Director of the New Orleans Family Justice Center, Heidi Martin, a nurse and the Forensic Program Coordinator for the Emergency Department at the University Medical Center, New Orleans, and Samantha Eldridge, a nurse and researcher also from the University Medical Center. We are also grateful to be joined by two survivors of intimate partner violence who are here to share their wisdom with us today, LaShonda and Shira. So let's get started. Since the lockdowns began last March due to the COVID-19 pandemic, professionals in the domestic violence field have been concerned about the impact of isolation on gender-based violence, including increased rates of intimate partner violence created by the stressors associated with the pandemic, the inability of victims to safely reach out for help, and barriers to receiving services created by the pandemic. It's been a scary time for everybody. So I really want to start with kind of the big picture, and I'm going to start with Dr. Taylor. So we heard the term shadow pandemic as early as April of 2020 is when I heard it first. Could you tell us more about this issue and why it's been such a concern?
Sure. The United Nations coined the term shadow pandemic. And I think the one thing to begin with to frame this entire conversation is to understand that domestic violence has always been a pandemic. Now that we as a world have lived through a pandemic, maybe we'll have a little bit more understanding and perspective on the nature and scope of something that really affects everyone, because domestic violence always has. We just haven't all seen and felt those effects as acutely as we have the coronavirus. So, when this all happened, my very first thought after kind of thinking, what does this mean for my family, was, oh no, domestic violence is going to get worse during this. And at that point, we thought it was going to be a few weeks, right? It's going to get worse because it always does when bad things happen, whether that's a sports team loses a big game, or it's an economic recession, or it's a global pandemic. Domestic violence always gets worse when things get bad. Then adding to that, the social and functional stresses and economic stress and uncertainty and all of those things that also always make domestic violence get worse. These were just kind of some of the first things we started to feel with the pandemic. The second thing I thought is, oh no, what do we do? Because what we're all when we went into lockdown and realized, this is going to be more than 2 weeks, what are we going to do to help people and to reach people? Because what we are all supposed to do right now is precisely nothing. We're all supposed to stay home. Our community service is to stay home and do nothing. So what does this mean for people who are trapped in their homes? And this is where isolation becomes such an important thing to understand. People who are being abused in their home, whether that's adults, whether that's children, and we've seen increases in both of these, as I'll talk about in a little bit. But when they're trapped, their access to resources is going to be limited. Maybe there will be no access at all. Maybe they can't even learn what resources are available, because in order to do that, you have to make phone calls, you have to go online, you have to do things that an abusive person is going to be watching over and limiting, your ability to do. Imagine if you pick up the phone and call someone and say, how do I get help for abuse right now? That doesn't even make sense when the abuser is right over your shoulder. Isolation has always been used. It's a key strategy and tool that abusers use to exert and maintain the power and control over their partner to which they feel entitled. So that isolation has always been a big part of domestic violence. Now we, as the whole world, are supposed to isolate ourselves and not be too problematic. We're not supposed to go to the emergency room unless we really, truly think we might be dying of something. And so, places and opportunities where there might have been intervention before, going to the doctor and getting screened, and then that being an opportunity to say, yes, I am, I know I'm not safe in my home. Yes, I do need help. Opportunities to, to reach out were limited, if not completely removed altogether, because we're mandating isolation. So again, this is adults, primarily women, and children who were suffered the hardest from the effects of the isolation part of the pandemic.
Yeah, it's been such a scary time for everybody, but the business about isolation and control and understanding that abuse is not just about it's not just about hitting, it's about control, and abusers have increased control when they have you all to themselves. So that's been pretty scary. So, we've had Mary Claire, I'd like to ask you a little bit about what the Family Justice Center experienced in terms of calls for help. I'm going to put you first.
Yeah, I think the calls certainly did increase, and we increased our ability to reach out to survivors because we knew that the call to stay at home was not going to necessarily be something that was very productive for survivors. And we knew that it would put them at enhanced risk. And so our goal, once we had a stay-at-home order, was to do everything in our power to stay connected to survivors and find out what was going on and to give them resources. And what we continually heard from survivors is that they were just so happy to stay connected, either by phone or by text, or eventually we got webinars and Zooms and all kinds of platforms to stay in touch with survivors, and they really appreciated that. And, I think part of it was adjusting to what was happening with the different systems. We found many agencies shut down, and so we were one of the few agencies in the city that was still answering our phone with a live person, trying to navigate and try to hear what was happening in the city. What we were hearing is that the court systems were closed, and so we were navigating how to get temporary restraining orders processed and back on track, and what we had to do to provide that service. We heard that the jail was no longer going to admit perpetrators of violence because they didn't want them to get COVID, and so we were seeing offenders who were doing harm to survivors and who were putting them in more danger being let out for $100 bonds and continued to stalk survivors, which was just not helpful for us in terms of maintaining safety for some of these survivors. And as a result of that, what we were hearing from survivors is that they no longer even wanted to call the police because they felt that if they called the police and he was arrested or she was arrested, that they would be out within an hour or two, and they would go directly back to the person and take it out on them. So even to call the police during this time was very risky for survivors. And so, we did have to pivot in a number of ways to try to figure out how we can, keep them safe, keep connected to them. And survivors, what we know is that they're very resilient. And even if they are isolated at home, they were able to get in their cars, make the phone calls to us, do their therapy sessions with us. And so, we just figured out how to do this work in a very different way.
What was the impact of the pandemic on your staff? I've been reading that, it's been very stressful for staff because they're also isolated.
That's absolutely true. I mean, this is a unique kind of a disaster where the helpers are also experiencing the same trauma that many of our survivors who rely on us for help. Many of their kids were off of school. They were doing school from home. They were trying to navigate how to get childcare. So it has been significantly difficult, and we are seeing a burnout, and we as an agency are committed. We now close our agency, not completely, we still have the crisis line, but we try to give people at least a couple of hours a week to try to recover and try to take self-care time for themselves. We really try to encourage them to take as much sick time as they need to recover. We are seeing a high level of burnout, and we're trying to address that and be as supportive as we can, because we need our staff to continue to be there for our survivors. So it is a challenge, and it is something we are very aware of and really trying to address.
Yes, I just apologize that my dogs are barking. So in case you hear them, I cannot stop them right now with the barking. But yes, I experienced my domestic violence situation in 2017, and I continued working with my New Orleans family justice counselor through the pandemic, and by phone and via text. And I cannot say how thankful I am for that agency to not just help me during a major crisis in 2017 and 18, but also continue be on my side to learn self-care, self-healing, and moving forward in life, which during the pandemic was when we all were isolated, but I was also isolated, helped me to just continue on my journey for a better future. And without that service, I would have not made it.
You know, you mentioned to me when we spoke earlier that in many ways the virtual access to your counselor and to groups was really an advantage. Can you talk a little bit about that?
You mean with the groups, the online groups? Yes. So first, my counselor and we were just connecting by phone. Other things were not available right away, but just the phone calls was like, that was the light at the end of the tunnel. I always was looking, and I still do, look forward to my counselor sessions. And then slowly the Zoom calls came up, and then we did other classes like we did before in person, and then it was available via Zoom, and it was actually fun. It was kind of like, oh yeah, I'm back with other survivors, and we're gonna do this today, and it was just another highlight, looking forward to it and learn from it. So I mean, I don't know where I would be without all of that help.
Thanks for sharing that. Heidi, I want to talk to you about the experience of hospitals. You know, the hospitals, of course, have been ground zero for COVID treatment and COVID patients. How did this impact your ability to serve survivors of domestic violence and sexual assault?
Yeah, honestly, it didn't really affect our ability to provide service in a negative way. Initially, there was a lull for patients presenting with complaints of sexual assault, which was, of course, very concerning for us, as we can only assume it's still happening, but people were hesitant to leave their homes for fear of infection. And, you know, with good reason, everybody's quarantined in order to stay at home anyway. We know that even not during COVID, during a pandemic, that people don't present as often as these crimes occur. But during that time, we were actually able to get more staff in place. Since we are an ED, we are available 24/7. And now we actually have backup coverage for when multiple patients present, because it's kind of feast or famine when patients present for us. Sometimes we won't see anybody for a day or two, and sometimes we'll have 6 or 7 patients at once. Things did pick back up as far as the numbers that we saw. We actually in 2020, we've seen the most patients that we've seen in a single year since I've been here. So it picked up quite a bit.
Wow. So, so I guess it changed the quantity, but did it change the kind of the quality of who you were seeing? It did in terms of who was presenting for services, especially early on?
Yes. So while we did see, we saw a decline in patients that had a lower acuity, while those with higher acuities did continue to make it to the ED, thanks to the efforts of EMS on scene, bringing people in just to get evaluated, because sometimes people were trying to come in just for an evaluation. But overall, the numbers, like I said, went down, which was concerning for the community. As you can imagine, there were probably lots of individuals who could have still benefited from services that did not seek them. But we definitely saw much greater acuity in the injuries that we were seeing.
Right. So it's a complex number system that goes on, because on one hand, we were really thinking that our numbers for calls for help were going to go up, but they didn't actually go up at first because people were having harder time asking for that help, and then also being afraid to seek help, particularly medical help. So it's a really complex issue, which I think we're going to dig through a little bit more. I'd like to check in with LaShonda. I'd like you to maybe tell us a little bit about your experience, which happened just prior to the pandemic.
So prior to the pandemic, I experienced abuse back in 2019. I was 32 weeks pregnant when my abuser physically assaulted me and killed my baby and sent me into the hospital. That was back in 2019. So I've just been dealing with the criminal justice system ever since then. Also, I've been trying to, manage my mental health, because I do have PTSD and all the trauma associated with that. During the pandemic, the isolation part is what's mainly getting to me at this point, and has been getting to me since the start of the pandemic. The criminal justice system part of it all, he was released off of his GPS monitor at the very beginning of the pandemic for the explanation that the pandemic, they could no longer have him on there. And that was the only explanation that I really got from that. So just been dealing with criminal justice part of it since the pandemic started, which has been a frustrating and very slow process.
I can imagine. It's been one of the concerns that we've spoken about, Ray, in terms of people being able to seek justice and the justice system actually responding to it. So overall, LaShonda, how did the pandemic impact your ability to even feel safe?
So my abuser has violated the protective order, and I was told by my lawyer to call the police, put the report in, and they should come out and talk to me in person. They did not come out and talk to me in person. In fact, they let me know that because of the pandemic, and anywhere that, them coming out would take a lot longer. Back in 2019, at the start of everything, there used to be police officers sitting outside of my house to monitor, and they are no longer there because the pandemic has stretched out the police force in Austin, at least, so thin to where they couldn't spare anybody.
And how does that affect your mental health?
It's been a roller coaster, good days and bad days. But for the most part, it's increased my paranoia, especially the mask, because with the mask, you think that you see the person everywhere because you can't see the bottom half of their face. You just see their eyes and their head. If they don't have any other head coverings or goggles on. So increased paranoia, therefore an increase of nightmares that follow. So trying to manage that, which I'm dealing with in therapy. But even then, with the pandemic, it's very hard to schedule therapy appointments and to remain safe at the same time.
Yeah, I mean, you're really talking about PTSD, and it's a very common after effect of being a victim of domestic violence, and then it's just exacerbated by the situations caused by the pandemic. It must be really tough. Samantha, how common do you feel LaShonda's experience is?
I'd say, LaShonda, your experience is very common. You're not alone in that. We've actually had patients come in that we get consulted on them specifically through our psychology department because they are coming in due to stress, due to that fear, that paranoia. This person's been released. Somebody I heard through the grapevine, he's out of jail, and their mental health declines. And then we end up seeing them. We've also seen, I know I personally have seen many patients that they're hesitant to ask for help or report because they feel like it's not like what's going to happen. No, all it's going to do is just make him madder at me, and I'm not going to be safer. It's pointless. So that's been a big struggle for us, trying to help people when they feel like the help actually hurts. I think a lot of times, like, our advocacy centers are far more welcome than the law enforcement, it seems like, because they do so much more and have so much more support. And the police can only, I guess, go so far. They have these rules, especially with COVID going on, like you were saying, they're stretched thin. A lot of times, like, I mean, restraining order, it's just a sticker on a paper somewhere. Like, what does it do for you? And patients, especially ones that have been through this numerous times, because domestic violence is so complex and it's not a come in and get it fixed in 2 hours type of thing, that they've kind of lost their hope in that particular part of the system.
Well, have you seen an increase in suicides or attempted suicides related to this? Is there any data on that?
Not as yet. That's part of, my research that's starting now that we're on the back end of this and things are normalizing. I will be able to hopefully look at things like that. But a lot of our idea so far is, like, it's anecdotal. Like, I feel like I've been seeing a lot more people that are coming in that need, psych help because they're so hopeless and they're so stressed out. But those kind of numbers, hopefully we're going to be able to learn a lot when we start looking at all our data.
So tell me about what you're measuring. Tell us some more about that project.
Okay. So I started working in the forensic department last February, which happened to be Mardi Gras. So you can imagine it was insanity circus. And then the pandemic hit, and we had, like, suddenly this huge drop. Like, we had 55 sexual assaults in February and 26 in March. Similar with our DV, IPV, interpersonal violence patients, it dropped initially and it slowly climbed back up. And like Heidi was saying, we're all wondering, they're not here, where are they at? Because it's still happening and we're not being able to help them. And the patients we were seeing were coming in the back of an ambulance. They didn't want to be here. The first thing out of their mouth was like, how am I going to be here? I'm scared. I don't want to be here. Not because of the domestic violence, but because of the virus. So it started getting the wheels turning as far as, like, how is this going to affect our patient population? What could we do better? How can we help them? So now that we're kind of on the back end, things are normalizing a little bit. I've got a team together, a statistician, epidemiologist, our medical director, and a nurse researcher through LSU and University Medical Center. And we will be looking at data from 2020 and 2019, comparing the 2 years. Specifically, we're starting out looking at the severity of our cases, how many patients needed CT scans, how many patients needed surgery, were their lengths of stay in the hospital longer? Did they have more injuries? Did they need more resources? Did they need housing more frequently? As well as things like what kind of patients are we seeing? We see a lot of tourism in New Orleans that obviously kind of dropped for quite a while, but we were seeing a lot more patients that were homeless or complaining of homelessness. A lot of people lost their homes because they lost their jobs, because New Orleans is a city with a lot of tourism, and restaurants were shut down, music was shut down, people had nowhere to go. So that just made people even more vulnerable. So that's kind of the data that we're exploring to see what's the big picture. What could we learn? What happened to our population, and how can we make things better for them? And what can we learn from this? Because it really, I mean, everybody's wheels started turning when we first started seeing this happen. Anybody who works in this field became very concerned. So we want to kind of see what the data can teach us.
I think it's really important that we do that. Hopefully we're not going to see another pandemic like this in our lifetime, although that's probably a big hope. But there's so much to learn. And so Ray, you've had your eyes on some of the national trends, international trends. What are we seeing across the country over the last year, the trends that concern you the most?
I think it looks like those of us who do this work knew that it would. It does take a little bit of time for official numbers to come out. Research is slow. But what we know is that, not surprisingly, rates of all forms of domestic violence, physical, psychological, emotional, sexual, and lethal homicide, increased all over the world. And just to give you an idea, the province in China that was sort of the epicenter of COVID saw a 300% increase in domestic violence, lethal and non-lethal. Great Britain saw over a 50% increase in their homicides, domestic homicides. So many U.S. cities saw, all U.S. cities saw increases, and including in homicides. And some cities reached the number of domestic homicides by early fall that they had the whole year, the previous year. And as they've mentioned, these are increases in frequency and severity, onset of violence where there wasn't any, increases in frequency and severity where there was, and not necessarily proportionate to the calls. So we've talked about this a little bit, and Mary Claire said that the Family Justice Center saw an increase in calls. We know that the New Orleans Police Department saw an increase in calls. I think that speaks probably to a lot of the work that the Family Justice Center does and makes it so that the community feels like they're more accessible and like they're more able to reach out. But some areas saw some other areas saw increases in calls to DV hotlines, to the police and things like that, but a lot saw less, some as few as 50% or less than their typical calls. And so, like Heidi said, this is not a time where people in this work go, oh, good, everything's better. We know that people are suffering in silence. And so when we don't get calls that are at least on the same, level as our trends usually are, we know that people are hurting. It's very, very dangerous. So for agencies who weren't getting the calls, they were getting things like desperate text messages, emails, and these are things people could do when they would go to the bathroom and shut themselves in and have their cell phone and just, cries for help in the safest way that they could. So the implication for that is that when people did call the police, when they did seek out medical help, like Samantha said, they're now in an ambulance. They're now feeling that their lives or the lives of their children are in imminent danger because it took that level for a lot of people to reach out. So when a person feels like it might be a life or death move to reach out for help, they feel like, I'm going to die anyway at the hands of this person. I may as well try to get help. So that's how absolutely desperate the situation is. And let me just, I don't know if anybody saw this. In the last week, I saw a study that some folks in New Zealand did on Google searches during the pandemic from March 2020 to August 2020, worldwide Google searches. And they saw hundreds of millions of searches for statements like, how to beat my wife without leaving a mark, how to control my woman, how to kill my wife, those kinds of things, and hundreds of millions of those. And those kinds of searches do go on, but searches for things like how to beat my wife and not leave a mark, how to kill my wife increased over 30% from the year before. Google searches about how to control my woman increased 67% worldwide from the previous year. And then here's the thing, when people would search for those terms or those statements, they would get essentially instructions on how to do it, and videos, things that how to take control, how to stop being, whipped by was one of the terms used. So lots of resources on how to become an abuser when people sought, the hundreds of millions of people that sought out that information. On the other hand, hundreds of millions of searches for he won't stop beating me, he won't leave, I'm afraid he will kill me. So these are presumably by women. The searches about help, I'm afraid he's going to kill me, were increased 85% from the previous year. Searches for he won't leave, what do I do? 95% increase from the previous year. And then about 30% increase for searches related to I'm being beaten, he won't stop hitting me, those kinds of things. And then here, finally, those searches did not produce the same resources. So, if you Google pizza, it's going to give you immediately, it's going to pop up and give you recipes for pizza, all the places that are close to you. It's going to know that you're interested in pizza, and Google over delivers on helping you find those resources. That's not the sort of thing that pops up when people would search for, I'm afraid he's going to kill me, he won't stop beating me, how do I get him to leave? The same kind of resources that are available for people seeking information on becoming an abuser are not then provided when people are seeking information on saving their lives. So these were all obviously concerning, but again, in the way that we've studied these things for decades and decades, these are patterns and trends that were unfortunately very predictable.
That's horrifying. It really is. And first of all, it's mind blowing that those resources exist, to learn how to kill your wife or not leave a mark or get away with it. But it shouldn't surprise me when there are television shows like How to Get Away with Murder, right? It is really horrifying, and it's very disappointing that it's not as easy to find the resources to save yourself as it is to find the resources to hurt somebody. It tells me that we all have to do more, and we have to work harder to get that information out. In terms of some of the systems that are out there that are providing services to survivors of intimate partner violence, healthcare, education, criminal justice, what do these trends tell us that they need to do?
I think it all comes down to education and awareness. And these are systems, and this is a systems approach that we advocate for, where our education, our justice, our law system, our criminal law system, our government, our churches, our family, our healthcare, these are our major social institutions, and they are systems. And so a systems approach is the only one that's going to be effective. And we're also busy working and doing our individual things, and so that we do those things in a very siloed way. And the people on this call are exceptions. These are very, very busy, emergency department nurses who also take time. I see them everywhere educating the community. Mary Claire's running a major organization in our town, but she's everywhere educating people. I saw her on a webinar last week educating new prosecutors on how to handle these cases. So education is everyone's job, from the medical professionals and the emergency room and in the OBGYN and the dentist's office to, in our schools, and teaching children. It really starts with children, young children, in age appropriate ways, things about healthy relationships, healthy conflict resolution, consent, all of this. So education is prevention, and it is intervention, and it's all of our responsibility. One of the most powerful speakers that I bring into my classes at my university is Detective Eric Risch, who's with the New Orleans Police Department. He's amazing. He is the exception, not the rule, unfortunately, in that he is so absolutely knowledgeable and trained and passionate about domestic violence. And we'll get into some of the criminal justice problems. But when you have people like that who are educators and make it their business to be a part of the solution in that way, and what is otherwise with police, primarily interveners, responders, once something has already happened. And then the whole justice system as a whole. But then with healthcare, I think that's really kind of a focus of this call as well. They are so great, not only at responding and treating when something has happened, but being a part of studying and understanding, and then that intervention and education piece as well. So in terms of systems, we all have to work together and we all have to communicate. And one of the findings, the National Commission on COVID and Criminal Justice, this group that was assembled to study this stuff, found that the lack of communication across the systems was one of the leading factors in ineffective and inadequate responses to domestic violence during the pandemic.
Wow. And it seems like it's the easy thing to do. Let's just talk to each other, right?
Yeah.
Heidi, so after treating victims of a new disease that put all this stress on the healthcare system, what have you learned about the needs of forensic nursing in a crisis?
Okay, so COVID was definitely an added concern for us. Services were still provided. It did increase the complexity of getting the patients in to be seen, just with the screenings, temperatures taken at the door, the added PPE requirements for everyone, masks. But like all other disasters here at UMC, we maintained all the services. I did learn that we need to be really flexible. In general, you need to be flexible when providing emergency care. It's just the nature of the beast, it's the nature of what we do. But what we need to do is always maintain that flexibility and open communications. And I think we touched on this a little bit already, but open communications with our community partners so we can continue to provide coordinated services on a similar scope to non-pandemic times. And I'm happy to say that overall, working with the Family Justice Center, like doing phone advocacy and whatnot, I feel like we've been pretty successful in doing that for the patients that did present to UMC during that time.
Mm-hmm.
That's great. Samantha, did healthcare workers in your facility continue to screen for intimate partner violence? I have heard from other organizations and other hospitals that, that screening just didn't happen. So kind of that regular, HIT screening or whatever that tool that your healthcare facility uses. Did it happen? Does it need to happen? How important is it?
Well, us as nurses, we are very well tuned to treating patients holistically. What they come in, what they present with isn't the whole story. And it is actually mandatory for us to screen for safety in the home, and specifically at our hospital, because we have such a well-established forensic team. Everybody knows how to get in touch with us. Everybody knows, please call us for anything, even if they deny everything, but you don't like the way their eyes were shifting when they said it. Please call us. So we, from the emergency room to the operating room to the clinics, we have educated our staff to please reach out to us. And, as I was saying about our research, the reason why it's so important to look at what this can teach us is because, like everyone else has pitched in and said at some point, the pandemic is a big crisis, but there's also many other crises that we deal with yearly. Even to the point where, like, I kind of laughed when Ray was saying about the football game, because we like to make sure we have plenty of staff the day after a football game, because it's probably going to be bad. It's just, and that's just like a laughable crisis to us, but in that perpetrator's mind, like that's, weapon enough for him. So we know that we need to be prepared, and especially even though with COVID, with all the restrictions and how much harder it was for people to come into the hospital, that please, please, please call us. We're here. Our services are still available. You know, the rest of the world might have crumbled, but us nurses, we're still getting up and still putting on our scrubs and still reporting at 7 a.m. We were there. We never lost a shift. We actually picked up extra. We were there. So that's I guess the challenge is getting more, encouraging people to come in, because we're definitely still doing everything that's expected of us and still willing to help in any way that we possibly can.
In a crisis, it's easy to forget the holistic and just deal with the emergency, right? And so it's so important, I think, for everybody to just keep remembering the big picture, that these other problems don't go away. In fact, they're worse. Mary Claire, could you talk a little bit about your thoughts? I mean, I know that the Family Justice Center works closely with the courts, but the courts really weren't prosecuting these cases last year in many jurisdictions. What happened?
And actually still aren't. I mean, you know, jury trials and trials in general are really not even open. I would say the court, for all practical purposes, is still not open. I mean, they're doing some Zoom trials, but that is pretty limited. And you know, I guess, you know, what I need to say about the criminal justice system, even in a perfect storm, or even when it's no extra pandemic or disasters, doesn't really function very well in and of itself. And I think we as a movement have relied on the criminal justice system to be the answer to a very complex social issue that it really can't handle. And so I think one of the things I'm trying to focus in our system, and the Family Justice Center is that big umbrella where we can really eliminate the silos and really master that communication between the systems, so that survivors aren't caught in the holes in that. But even with that, you know, when the criminal justice system doesn't work, and you know, I can tell you one of the hardest things that happened to us is, for the first time in over 20 years, we lost a survivor that we were actively trying to keep safe. And her perpetrator really tried to kill her. She was pregnant, tried to kill the baby. And we were moving her from location to location to keep her safe. And the fact that the criminal justice system let him out on a $100 bond made him very dangerous and made her very unsafe. And unfortunately, after 3 months, he was successful in killing her. And that was just devastating to us, because we knew we were giving her hope, and she was finding hope. She was looking forward. She was making plans. She was feeling like she was finally going to be free. And she ended up being killed. And so that's just devastating when you know the systems and, you know, our ability was limited in terms of keeping her safe. And we probably had more resources during that time than we typically normally have. I mean, we were putting her in B&Bs, we were putting her in, you know, a number of different locations, and we still couldn't keep her safe. And so one of the things I'm really working with the criminal justice system, and I just want to give a shout out to Heidi and her team and the whole entire SANE unit, because they have come on board and now doing not only SANE examinations for sexual assault victims, but also addressing non-fatal strangulation and other kinds of injuries for domestic violence injuries. And we do the same thing here for those, and we've been working very closely, because we know that victims who are strangled are 70% more likely to become a domestic violence homicide. And so if we can get the system to really focus on that, and those are difficult cases as well, because 50% of the time there are no visible injuries that can be seen. But as Heidi and Samantha know for sure, that if you have special equipment and you have special cameras and you have abilities to take extensive x-rays, you can see the internal images and internal injuries that are occurring to these survivors. And so I'm really working with the district attorney. We cannot let these perpetrators be released without giving us some time to be able to get these survivors safe. And so we have a long way to go. The criminal justice system is not the answer to all of these questions and all of these problems. But when we do need the criminal justice system to really stand up and to be effective and to really address the perpetrators who are more than likely going to kill, that's when we really need it to work. And that did not happen during the pandemic. It's still not happening, but we're going to keep pushing forward to make these systems understand what the really high risk cases are and how we can really mobilize these resources so that we can keep survivors safe, and then find other kind of alternative interventions for people that may not be the murderers and the people who commit homicides, but really better addressing strangulation. More than 60%, I've been tracking this since 2013, thousands and thousands of survivors who come here for services, and over 65% of those survivors report non-fatal strangulation, and many of them more than one time in an incident. So we have to get better at really identifying and assessing these cases and making sure that the criminal justice system is really looking at these cases, not downgrading. We've done the law, we've changed the laws. We've made non-fatal strangulation and a domestic violence battery a crime of violence and a felony. And so we have to make sure that the system doesn't downgrade these very serious felony cases to misdemeanor cases, which oftentimes it does. So we still have a lot of work to do in terms of really getting the criminal justice system. And the other thing I would say that we learned through the process, we probably were doing more intakes by phone than we have ever. We served more survivors, over 4,000 in 2020. And the downfall and the limitations of doing it over the phone is that we aren't able to have survivors come in so that we can really have that one-on-one conversation and really able to see them and see, the injuries that we may be able to identify that they may be downplaying, or really helping them to connect the dots in terms of, these symptoms that you may be having, difficulty hearing, difficulty swallowing, just a number of things that are probably an ongoing medical condition from the strangulation. We're able to connect that for them. And normally they don't even connect that to a strangulation incident. So, we've had to be very creative and trying to get a better sense of really what's going on with survivors, really being able to do that lethality assessment to determine really how much danger are they in. Do they recognize how much danger they're in, to really give them the resources that they need to stay safe during this period of time? So there definitely was some challenges. We're very happy that now we're beginning to see survivors coming in now that our entire staff is vaccinated, and we can tell survivors, we're safe here, you can come here, and they're feeling more and more comfortable to come in. And I think we get a better sense in working with UMC and our forensic team to really better identify what these survivors are really dealing with. And we see a lot of suicide ideation among our survivors that are in therapy, even now. So I would say, Samantha, even if you're tracking 2019 and 2020, we need to keep doing that in 2021, because some of these are really catching up with survivors now. They may have survived and they may have gotten through it, but now we're seeing the same kind of burnout and the same kind of mental health responses and consequences of the PTSD, that they may not have been able to really address it in the way that would really help them to heal and to move forward. So
I think it's really, I think I'd like to check in with LaShonda and Shira around that whole issue of PTSD and the fact that yes, the abuse might have happened in 2019 or 2020, but here we are in 2021, and we're still dealing with the after effects. And that is something that people really tend not to understand. That, you know, we look at domestic violence as kind of a one case by case, incident by incident, and that's not really how it impacts survivors. So, LaShonda, I wanted to check in with you because so much of what Mary Claire was just talking about kind of reverberates around your experience in terms of your abuser being let out on bond and his ankle bracelet no longer being monitored. And that has impacted you. Could you talk to us a little bit? Unmute.
Sorry, thank you. I'm sorry, I'm a little emotional. Mary Claire, what you were talking about with pregnant clients and I'm sorry, it resonated with me a lot. I had 2 incidences of strangulation. That wasn't what killed my child though, but it is what I ended up having to go to the hospital for, along with everything else. Sorry, my dog is halfway emotional for animals, so she's in response to my emotions. Okay. But yeah, all this happened 2019. It's 2021. I have lost hope. I've gained it back. I've lost hope again. It is a roller coaster. I have been blessed to have a huge family where we are able to now talk about domestic violence. We're able to talk about my mental health in a way that helps me and benefits me. I have some really amazing friends who also, they're in here now watching and supporting me. This is my first time ever talking about this experience to, not to call you guys strangers, but strangers. And out in the world, it is draining. I must say, it is very much draining to have PTSD during a pandemic and having to re-find another trauma group because my closed trauma group only had 10 sessions and it was very much helpful. But I do think I need another one because PTSD is not it's over. You wake up and it's over. It is a long-term thing that you will have to deal with. It is walking down the street, walking to check your mail, and then being triggered because you think you see somebody who looks like your abuser, or you go into work one morning and you see somebody with a baby. I work with a lot of women, and my clients are women, and not having to, I cannot work with pregnant clients. It is a trigger. It's hard. It hurts, but it's also, it limits me to how many people I can help. And so from that and from that thought process, it is exhausting. The paranoia that triggers into nightmares and not being able to get enough sleep. The pandemic and the shadow pandemic is extremely, extremely exhausting, along with the criminal justice part of it all. That's taking forever and not having any justice done. It is hard to heal from something that is still opened.
Yeah.
And the more triggers that I have is the more salt that's being poured into my wound. And it's just hard and exhausting.
I'm seeing messages in the chat room saying, stay strong. God bless you. Shira, maybe you could share a little bit of your experience. You're a couple years farther out from your abuse than LaShonda. That anxiety doesn't, and PTSD doesn't necessarily go away. Does it get more bearable as time goes by? You're muted, sweetie.
Well, get PTSD better? Yes. Gets it worse? Yes. So it's basically both. And I am a domestic survivor for many, many years. So the last incident I decided will be my last one. I will not anymore allow myself to get in life in this kind of situation that I will be abused again. And but I had a hard time with PTSD too. I'm even approved for a service dog for PTSD, and but it's not possible right now because I have 3 other dogs who are not that high trained, so it's not possible. But for me right now, it's better because I learned a lot from the New Orleans Family Justice Center, how to heal myself and how to do self-care. I had no idea what self-care really is, and I wasn't really sure how to I basically, when I walked out of an abusive relationship, or I stopped talking about it, and I was never really healing. And in 2017 and 18, my counselor always pointed out the danger I was in, and that this is PTSD and what self-care is, and made me write this all down. And now I understand it. And so I use the pandemic and with her guidance on a weekly base, to overcome those triggers that LaShonda is still going through. Do I have concerns about my abuser coming back? Yes. But at that point now, I did everything to protect myself with all the tools that are available to me. There's nothing else anymore I can do. I have to move forward and be strong, and start also find joy back in my life. For me, some of those listening to some of you guys was very informative, but very, very hard. It was very emotional for me. It was really, really hard. Even regardless, it was so long time ago. I thought, man, I'm gonna walk out of this now, honestly.
Well, it's, I
But it was good information. Sorry about interrupting.
Well, I so appreciate your doing this, even though it's hard, and I hope that by sharing your information, it's helpful to you, because I know it's helpful to the people who are hearing your stories. So thank you to both of you. We're almost out of time, and I just really want to touch in with you guys about this notion of a shadow pandemic. What's in a name, right? So domestic violence has been in the shadows of the public consciousness forever. And I'm wondering, how do we create maybe our own Me Too movement? How do we create a societal shift in how people respond to intimate partner violence and sexual assault? What are your thoughts? Just kind of a quick thought. I'm going to start with Samantha. You're on the hot seat.
Okay. I would encourage victims not to be ashamed to come in and tell us what's going on and ask for help, and to know that, when you do come in and you speak to a nurse, you reach out to the Family Justice Center, that they're there for you and you alone. So, if we can educate the public to not be afraid or ashamed to ask for help, I think that would be a huge leap forward.
Heidi, what do you think?
I think that these issues have kind of been forced to the front because of COVID, at least from my perspective, speaking in reference to both the number of patients we've seen and the acuity. The pandemic has definitely increased stress in our communities, but I think the most important thing is, now that we are talking about it, just to keep talking about it, to keep the dialogues open across the board with all of our partners, and do more education, and just to keep talking about it. And like Sam said, that there's no shame in asking for help. And like LaShonda was saying, like, she's able to speak to her family about it. We need to normalize talking about it, I guess, is what I want to get at.
Cool. Mary Claire, your thoughts?
I would say, when we first had the stay-at-home order, I think the biggest challenge for us was, what if home is not a safe place for you? What if home is not the place that you can find safety? And you may be safe from from the virus, but you may be in more danger than you've ever been. And so navigating through just that word and what that means and how do we respond and how do we pivot what we're doing to try to address that that reality. And we also knew that the pandemic was really going to cause survivors to not feel like it was a good time for them to try to leave an abusive situation because there were so many challenges that they were facing if they've lost a job or lost revenue or income. And so it really was a challenge. And I think that what we need to learn is, what happens when somebody is really not safe at home? And what do we do in the next pandemic when that seems to be the only solution, that people are not always safe in their home? And I guess I would like to close by just giving my heartfelt thanks to the two survivors. I know this is really painful to go through this and to share this, but it's so important for other survivors, and we know how strong you are. And I'm just so grateful for the survivors that help us in this work to learn about what impact this is having on you and what we can learn from you in terms of what we need to do and what we need to be for you during these times. So I just want to really give you my heartfelt thanks, and I will keep you in my prayers and thoughts for sure.
I think we all agree with that. Ray, I'm going to give you the final word.
Okay. Well, as you said, domestic violence has always been in the shadows, but it has always been a pandemic. According to the most recent national numbers, 1 in 3 women in the U.S. are victims of physical, intimate partner violence in their lifetimes, 1 in 3, and that'll be worse. The numbers for next year will be worse. So intervention and education and helping is truly a matter of life or death. Domestic violence has historically kind of been pushed aside as a private family matter, but it's really all of our problem. Just a word of perspective, again, something that we're all terrified of is terrorism. We feel like sitting ducks, but people who are in violent homes live with a terrorist 24 hours a day. Shootings, mass shootings, we predictably, they're back after things have started to open up. People are scared of that. You can go to the grocery store, you can go to school and be a victim of a mass shooter. But the most common, most frequent context of mass shootings in our country are in the home. These are domestic violence abusers who then kill their family. And so that's something we don't, for some reason, know and don't take as seriously and don't care about as much. So my hope is that post-pandemic, as public health has become a word people are familiar with and something that people care about, they really understand that domestic violence is and has always been a pandemic that needs our attention and that affects everyone.
Thank you so much. I want to thank all of our panelists for the work that you're doing to prevent gender-based violence. And thank you especially again to Shira and LaShonda for sharing your stories. I have a very strong belief that it's the stories of survivors that are going to change this problem. And so I'm really grateful for your courage and willingness to speak out. Thank you for joining this discussion about the shadow pandemic. We'd like to thank our presenting partners, New Orleans Family Justice Center and the University Medical Center of New Orleans, and our sponsor, United Way of Southeast Louisiana, Women United. Please visit us at voicesforchange.net to learn more about this and other educational resources on intimate partner violence.